Today we're tackling a topic that's absolutely fundamental to what we do here at Bethesda Spine and Posture, and in medicine in general, but often its complexity is really underestimated. I'm talking about reading X-rays. Welcome to our deep dive into the world of X-ray reading. Today we'll uncover just how challenging and technical this skill truly is. It's more than just looking at a black and white picture, it's about deciphering a complex story about a patient's health, often under pressure where every detail matters. I often get asked, how hard can it really be to look at an X-ray, and trust me, it's a question that highlights a common misconception. Think about it. We're taking a three-dimensional human body, full of intricate structures, and compressing it into a two-dimensional image. The amount of information packed into that single image is immense, and learning to see beyond the surface, to identify subtle abnormalities and to understand their implications for a patient's well-being, is a journey that takes years of dedicated study and practice. In this video, we're going to pull back the curtain on what it truly takes to become proficient at interpreting radiographic images. We'll explore the depth of knowledge required, the sheer volume of practice, and how this skill compares to other complex professions. My goal today isn't to intimidate, but to foster a deeper appreciation for the diagnostic process and the expertise involved in ensuring you get the most accurate care. So, stick around as we decode the art and science behind reading X-rays. So let's start with the fundamental challenge. We're looking at a flat, two-dimensional shadow of a complex, three-dimensional structure. Imagine trying to understand the entire layout of a house, including all its rooms, furniture, and plumbing, just by looking at its shadow from one angle. That's essentially what we're doing with an X-ray. Bones overlap, soft tissues create subtle variations in density, and what might seem like a clear area could be obscuring something critical. We have to mentally reconstruct that three-dimensional anatomy from the two-dimensional information presented, and that's a cognitive leap that requires a lot of training and spatial reasoning. This isn't just an academic exercise. The consequences of our interpretation are immediate and directly impact patient care. A missed fracture, a subtle sign of an infection, or an early indication of a degenerative process. These are things that can dramatically alter a patient's treatment plan and, ultimately, their outcome. If we misinterpret an image, it could lead to delayed treatment, unnecessary procedures, or even a worsening of the patient's condition. The pressure is always on to be as accurate as possible because real people are relying on our ability to see what needs to be seen in these shades of gray. Furthermore, the body isn't static. We're often looking for signs of how things are changing, or how they might behave under stress. For example, in spine X-rays, we might be looking for instability, which involves understanding how vertebrae move in relation to each other. This requires not just seeing the structures, but understanding their biomechanical relationships. It's about interpreting a dynamic system from a static image, which adds another layer of complexity to the task, demanding a deep understanding of how the body functions, not just how it looks. To even begin interpreting an X-ray accurately, you need an incredibly strong foundation in human anatomy. And I'm not just talking about knowing the names of the major bones. We need to know every bump, every ridge, every foramen, those little holes where nerves and blood vessels pass through. We need to understand the typical variations in anatomy, because not everyone is built exactly the same, and we must be able to distinguish a normal variation from a pathological one. This detailed anatomical knowledge is the absolute bedrock upon which all X-ray interpretation skills are built. Without it, you're essentially navigating without a map. Beyond pure anatomy, a solid grasp of biomechanics and even basic physics is crucial. Why? Because X-rays are, at their core, a product of physics, how X-ray beams interact with different tissues. Understanding this helps us comprehend why certain structures appear lighter or darker, and how artifacts or positioning can affect the image. Biomechanics comes into play, especially in musculoskeletal X-rays like those of the spine. We need to understand how forces act on the body, how joints are supposed to move, and what abnormal movement patterns or stress indicators look like. This helps us interpret not just what we see, but what it means functionally. Then, of course, there's the vast world of pathology. We need to be familiar with the radiographic appearance of a huge range of diseases and injuries. This includes everything from fractures and dislocations to infections, arthritis, tumors, and congenital abnormalities. Each condition can present with a spectrum of findings, some obvious, some incredibly subtle. Recognizing these patterns and understanding how they differ is a skill honed over years. And let's not forget radiographic positioning. Knowing how the patient was positioned when the X-ray was taken is vital, as incorrect positioning can create misleading appearances or obscure important details. It's a comprehensive knowledge base that all ties together. Chapter 3. The grind behind the glance. Dedication to mastery. Building that extensive knowledge base and the skill to apply it doesn't happen overnight, or even in a few months. It starts with extensive classroom hours during medical or chiropractic school, poring over textbooks, anatomical atlases, and radiographic technique guides. We spend countless hours learning the theory, the principles, and the common presentations of various conditions. This foundational learning is intense and demanding, laying the groundwork for the practical application that follows. It's a period of absorbing a massive amount of information before you even start looking at real patient films in a diagnostic capacity. After the initial classroom onslaught, the real learning curve begins with reviewing thousands upon thousands of X-rays. I mean that literally. During residency and ongoing professional development, we are exposed to a huge volume of images. We see the common, the uncommon, and the downright rare. Each X-ray is a learning opportunity. We start by looking at normal images to really solidify what normal looks like in all its variations. Then we move on to abnormal cases, often starting with more obvious pathologies and gradually progressing to more subtle and complex findings. This sheer repetition is critical for pattern recognition. Crucially, this isn't usually a solo journey. Mentorship plays an enormous role in developing diagnostic accuracy. We learn under the guidance of experienced radiologists, chiropractors, or other specialists who have seen it all. They point out things we might have missed, question our interpretations, and share their insights gained from years of practice. This interactive learning process, where you discuss cases, defend your findings, and learn from mistakes in a controlled environment, is invaluable. It's this combination of structured learning, high-volume exposure, and expert guidance that slowly but surely builds the confidence and competence to make accurate diagnostic calls. Chapter 4. Beyond the Clinic. Comparing Diagnostic Demands. To give you a better sense of the cognitive demands, let's compare X-ray reading to some other highly skilled, non-medical professions. Think about an airline pilot. They undergo rigorous training to interpret a vast array of instrument readings, make critical decisions in dynamic environments, and ensure the safety of hundreds of passengers. The cognitive load, the need for precision, and the high-stakes nature of their work share similarities with interpreting medical images. Both require intense focus, pattern recognition, and the ability to synthesize multiple pieces of information quickly and accurately, often under pressure. Consider professional photography, specifically the art of analyzing a photograph for its technical and artistic merit, or even forensic image analysis. A skilled photographer or analyst doesn't just see a picture. They see light, shadow, composition, focus, and subtle details that tell a story or reveal information. Reading an X-ray is a specialized form of this visual analysis. We're trained to detect minute variations in density and structure, to see patterns that an untrained eye would easily overlook. The visual acuity and analytical skills required are quite profound, much like a seasoned art critic or a forensic expert examining evidence. What about stock trading, especially high-frequency trading or complex financial analysis? Traders analyze charts, identify trends, and make predictions based on vast amounts of data, often with significant financial consequences riding on their decisions. There's a similar element of pattern recognition and risk assessment in reading X-rays. We identify patterns of disease, assess the severity, and our interpretation directly influences treatment decisions that have significant implications for a patient's health and well-being. Even coding or software engineering, which requires meticulous attention to detail, logical problem-solving, and the ability to debug complex systems, shares that demand for precision and understanding intricate systems, much like we must understand the intricate system of the human body through its radiographic representation. Chapter 5, The Ever-Evolving Skill, A Commitment to Care. So, as you can probably tell by now, reading X-rays is far more than a simple glance at a picture. It's an intellectually demanding skill. It requires a unique blend of encyclopedic knowledge, keen observational abilities, strong analytical reasoning, and a deep sense of responsibility. It's not something you master and then forget about. Medicine is constantly evolving, with new research, new understanding of diseases, and advancements in imaging technology. Therefore, the commitment to learning and refining this skill is lifelong. We are always striving to improve, to see more, and to understand better. This skill genuinely improves over time, with experience being one of the greatest teachers. The more X-rays you see, the more variations of normal and abnormal you encounter, the more adept you become at picking up on those subtle cues that can make all the difference in a diagnosis. Each challenging case, each consultation with a colleague, each continuing education course adds another layer to your expertise. It's a cumulative process, building a vast internal library of images and associated pathologies that you can draw upon when faced with a new diagnostic puzzle. This continuous improvement is vital for providing the best patient care. Ultimately, the ability to accurately interpret X-rays is absolutely crucial for correct diagnosis and effective patient care, especially in fields like chiropractic, orthopedics, and emergency medicine. It allows us to identify the underlying cause of a patient's symptoms, to formulate an appropriate treatment plan, and to monitor their progress. While technology like AI is emerging to assist, the human expert, with their integrated knowledge and critical thinking, remains indispensable. This skill is a cornerstone of diagnostic medicine, and its importance in guiding patients towards recovery and better health cannot be overstated. Outro beyond the image, the impact of expertise. So, there you have it. A glimpse into the intricate and challenging world of reading X-rays. It's a skill that requires a profound depth of knowledge, countless hours of practice, and an unwavering commitment to precision, all because patient well-being is on the line. It's a testament to the dedication of healthcare professionals who spend years honing this ability. Thank you for joining us on this journey into the intricate world of X-ray reading. Remember, it's a skill that sets apart true diagnosticians and ultimately saves lives. Stay curious and keep learning. I hope this has given you a new appreciation for what goes into interpreting those black and white images and the critical role they play in your healthcare. It's not just about identifying a broken bone, it's about understanding the complete picture of a patient's condition, often from very subtle visual cues. The ability to do this effectively is a cornerstone of good medical and chiropractic practice, and it's something we take incredibly seriously here at Bethesda Spine. If you found this video informative and want to learn more about topics related to spine health, diagnostics, and overall well-being, make sure to like this video, subscribe to the channel, and hit that notification bell so you don't miss our future uploads. We're passionate about empowering you with knowledge. As always, thanks for watching, stay healthy, and I'll see you in the next video.